We're really lucky that most pregnancies are joyous and happy occasions. However, most couples can't even imagine the things that could go wrong with a pregnancy, and that's where the maternal fetal medicine doctors come in. Maternal fetal medicine is a subspecialty of obstetrics and gynecology in which we take care of pregnant women that might have medical problems before becoming pregnant, or they develop unsuspecting problems later during the pregnancy. Aloha, my name is Dr. Manjean Lee. I'm a board-certified maternal fetal medicine physician at the University Health Partners of Hawaii. Since UHP employs the majority of maternal fetal medicine physicians in the state, we are the primary group of physicians that triage all of the sick pregnant women across the entire state. It's up to us to make sure that the patient and her baby are delivered in the safest way possible.
Hi, my name is Christina Kawakami and I was a high-risk pregnancy patient. In 2016, I was pregnant with my first child, daughter Elise. At 36 weeks pregnant, Elise was stillborn. My husband and I were just devastated. It was really the hardest thing was to lose our child so late into the pregnancy. But we knew we wanted to try again. That's when we sought out Dr. Lee and the maternal fetal medicine doctors.
She came back to us during her second pregnancy and insisted on being cared for by a maternal fetal medicine physician.
We chose to go with Dr. Lee and an MFM specialist because we knew that they would provide the high level of care that we needed. Being that I'm over 35, we had an unsuccessful pregnancy, and also because I have an autoimmune condition similar to lupus.
We came up with a different game plan by changing her medications and increasing her surveillance and increasing the number of tests that we could provide.
Dr. Lee was always so positive and always reassured me that everything would be fine. She was really the calming presence that I needed during the pregnancy because I was so anxious and very emotional the whole time. And at the end of 36 weeks, I delivered Emmy, healthy baby girl, and we were so overjoyed.
We're the doctors that are, crying with the patients when they're facing a pregnancy complication. We're also the doctors that cheer you on with the next pregnancy to try to get you a successful pregnancy.
We're so thankful for Emmy every day. Losing a child, you never forget that child, and Emmy is not a replacement for our daughter Elise, but we're so thankful and she brings us so much joy every day.
Brought to you by University Health Partners of Hawaii and the John A. Burns School of Medicine.
I believe giving back to the community is an important role for physicians, particularly now with our major social and economic challenges in healthcare. We can help to support all the stakeholders and really understand the way that the community works together to improve the health of our state. Aloha, I'm Dr. Carla Nip-Sakamoto. I'm a dermatologist and a director for the John A. Burns School of Medicine Alumni Association. I am a graduate of the University of Hawaii and worked for a brief time in nursing and then decided I really wanted to be a doctor. Then prepared for medical school, applied and got into JABSOM. Following graduation from medical school, I journeyed to Los Angeles to do my dermatology training. And while I enjoyed being in the big city, I really yearned to be back in Hawaii to help again take care of our community. And so I ventured back and opened up a private practice here at Queens Medical Center. As a director of the JABSOM Alumni Association, it is our desire to support the school in any way we can to help mentor students, to support them, give them opportunities, and also to keep our proud alumni engaged in the vision of the school. We have thousands of graduates, and as a result of that, we have a really strong network of individuals who can really lend us support and really give back to the school that nurtured them, educated them, and really helped launch our careers. I think the Alumni Association is stronger than ever now. We have great leadership, a lot of involvement from graduates from across the years, and we all have a shared vision for the success of the school. You might be interested to know that more than half of the physicians, practicing physicians in Hawaii, are somehow related to JABSOM. And considering that number, it's pretty staggering. And so JABSOM really plays a really vital role in our community and in the future of healthcare in Hawaii. For myself, I've been involved in some organizations that I really truly believe in. Perhaps the first I'd like to mention is the American Cancer Society. And as a dermatologist and a past board member for many years, I'm really involved and committed to the fight against cancer. On a broader scale, I'm a director with HMSA. I'm very privileged to actually have the insights and perspectives that impact our entire healthcare ecosystem. We all need to work together really for the health of our state. Being at JABSOM was one of my fondest memories of my lifetime. The friendships have really endured. And we get together at our most recent reunion and it's like time stood still. JABSOM does a great job of making sure that we all work together and really love ourselves, love each other, love our school, and love our community.
Brought to you by University Health Partners of Hawaii and the John A. Burns School of Medicine.